Now, we know that the federal government covers the cost of medicinal cannabis for over 3,000 Canadian veterans. We heard testimony at this committee on September 14th from the regional director of First Nations, Chief Isidore Day here, that the government does not cover the cost of medicinal cannabis for Indigenous patients at all. Can you explain that discriminatory policy to me?
To be very frank, that is Minister Philpott's department has been working with that, but perhaps that I could ask my Deputy Minister to perhaps address that a bit.
You know, Minister, if I may, I just want to direct my questions to you because I think we'll have the staff staying after and we can follow up them, but we only have you, I think, for an hour, so I'll just defer that if that's okay.
Absolutely.
I want to move to prescription drugs. I want to read you a passage. Prescription drugs. Our current system provides full coverage for institutional care, including all drugs administered during a hospital stay. Once patients go home, however, they are not guaranteed public coverage for medically necessary drugs. Although some public coverage is provided for specific groups and situations, prescription drugs have yet to be fully incorporated into provincial health insurance schemes. Many Canadians have limited drug coverage through their employers, but a full 12% of Canadians have no coverage at all for prescription drugs. This situation is plainly inconsistent with the values upon which Canadian Medicare is based. It is both unfair and illogical to guarantee access to medical diagnosis but not to the associated treatment. Neither does it make economic sense. Those who cannot afford to fill their prescriptions tend only to get sicker and require more costly treatment later from the public system. Public coverage of medically necessary prescription drugs, as recommended by the National Forum on Health, would not only ensure universal access to treatment, it would also reduce the amount of money that Canadians are already spending on drugs.
We need a question.
I'll get to that, Mr. Chair. These advantages include simplified administration, volume discounts for bulk purchasing, and improved monitoring of best practices for prescribing. A new Liberal government will pursue a strategy together with representatives of provincial and territorial governments, health service providers, private payers, employers and unions, and consumers to address the fact that drugs have become an essential component of health care. We will develop with these groups a timetable and fiscal framework for the implementation of universal public coverage for medically necessary prescription drugs. Minister, I'm reading to you from the Liberal platform in 1997. Promised by Jean Chrétien. Now, we've heard the PBO report has already shown we can cover every Canadian and save $4 billion a year. I introduced a motion in the House of Commons asking your government to start discussions with the provinces in the next 12 months, and you called that proposal premature. Can you explain to me why, after 20 years of promising federal national pharmacare, can you tell us what you're waiting for, Minister?
Well,
just very briefly, because we're way over the time for the questions, so if you could just give us a quick answer.
Thank you. I'll try to do it as quick as I can. How's that? If you've read my mandate letter, and I'm assuming on the Health Committee that probably most members have read my mandate letter, I'm going to quote, "Work with provinces and territories to improve access to necessary prescription medication. This will include joining with provincial and territorial governments to negotiate common drug prices, reducing the cost Canadian governments pay for these drugs, making them more affordable for Canadians, and exploring the need for a national formulary." Again, as indicated when I had the opportunity and the privilege to meet with the Ministers of Health for the first Ministers' meeting, we were able to come up with a consensus that we all want to work on improving access to affordable medication for all Canadians. And again, when we look at enhancing our healthcare system, we certainly want to make sure that enhancing the affordability, the accessibility, and the appropriate use of prescription is absolutely mentioned in that. So thank you.
That's all we can handle. Okay, now we're going